Hello and welcome to Searching for Web-Based Evidence Resources. Our objectives for this section are to examine the process of Internet searching for answers to address clinical practice questions and conduct searches to answer PICO questions from guidelines and evidence on the Internet. First, let's talk about PICO questions. You should have some familiarity with asking clinical questions from the PICO lecture earlier in this module. Let's talk about our case. We have an adult with heart failure, and we're wondering if patient education could keep him from getting readmitted down the road. So let's write that out in a sentence. In adult patients with heart failure, that's our P, does patient education, I, improve compliance and reduce readmissions, O, when compared to no education? That's our C. Doesn't necessarily have to be in order. Now that we have our PICO question, we're ready to develop search terms. Here is our question again with key terms in bold. We also want to list parallel or synonymous terms. Heart failure might also be called cardiac failure or CHF. Compliance could be non-compliance, adherence, or non-adherence. And readmission could also be called readmittance or rehospitalization. It's important to get all these terms down as we don't know exactly how sites are searching and whether only exact wording would yield usable results. Now let's talk about turning those terms into a search. Don't put in your whole question, break it up a bit. We also want to be sure to capture synonyms. Using AND looks for articles with both terms. Using OR looks for either one. To begin, start with the population and an intervention. How many results did you get? If it's more than 100, we need to narrow down the search by adding more terms. Keep doing this until you get an acceptable amount. Don't narrow down too far. Less than 20 results might mean we've gotten too specific and may miss out on important information.